Principles of the tympanic temperature. The body's temperature is regulated by the thermoregulatory center in the hypothalamus. Through various physiological mechanisms, it is the major site for the integration of temperature information. When the body's temperature is warmer than the set point, instructions are sent by the hypothalamus to various organs to cool the body down. However, when the body becomes too cool, the hypothalamus demands the body to do the opposite, where it instructs a warming response, where blood vessels are some of the targets under the control of the hypothalamus, which causes vasoconstriction when the body is cooler than the set point. This results in the vessels near the surface of the skin, called arterioles, to become narrower, allowing less blood to the skin's surface, and therefore, less heat is lost by the environment. Another mechanism used by the hypothalamus to warm up the body when it's too cool is shivering, which cause repeated contractions of muscle fibers to generate heat in the body. The hypothalamus also controls an endocrine organ known as the thyroid gland, which releases thyroid hormones from causing an increased metabolic rate and subsequent heat production. Activating the primary motor center in the posterior hypothalamus causes skeletal muscle contraction and shivering, leading to increased heat production. The hypothalamus also contains its own thermoreceptors, which are sensitive to the temperature of the blood. When the body gets too warm, the hypothalamus triggers cooling responses, include dilating blood vessels near the body's surface, increasing perspiration for evaporative cooling, and accelerate the rate of breathing, which can also help cool the body. The tympanic membrane is also called the eardrum. It separates the outer ear from the middle ear. When sound waves reach the tympanic membrane, they cause it to vibrate. The vibrations are then transferred to the tiny bones in the middle ear. The middle ear bones then transfer the vibrating signals to the inner ear. The tympanic membrane shares the same carotid blood supply as the hypothalamus. Measurement of tympanic membrane temperature and therefore reflects core temperature. Taking a tympanic temperature. Explain procedure to patient to gain informed consent. Clean hands to reduce the risk of infection. Press and release the on-off button. The thermometer will make an audible beep and perform a brief self-test when all the display indicators will be shown. Apply a new, clean probe cover. The thermometer features a hands-free probe cover application and removal. Inspect the ear for any signs of blood, infection, or obstruction. Gently pull back the pin of the ear and insert the probe into the ear canal and press the scan button while keeping the probe snugly in place. If the probe has been correctly inserted into the ear canal for the full measuring cycle, an audible beep will signal the end of the measuring process. At the same time, the measurement indicator light will illuminate for approximately 1 second. After obtaining the reading, dispose of ear probe cover and gel hands. Care should be taken when using the tympanic thermometer, as poor technique can render the measurement inaccurate. Temperature. Differences between the opening of the ear canal and the tympanic membrane can be as much as 2.8 degrees Celsius. Subscribe to the channel for more.